Happy Sunday, everyone. Welcome to Our Issues Birmingham. Today's guest, very timely, Dr. Mark Wilson, Jefferson County Health Officer. Mark, I hate that we're here again. I don't really know where to begin, but why don't we start by just talking about statistically where we are presently as compared to where we were, say, back in the peak times and where we're headed. Everyone says it's going to get worse. I'd like to be more specific about what exactly that means.
Yeah, so right now in Jefferson County, when I last look at our numbers, we're averaging over 450 cases per day in this county. And we're looking at like a 7-day average. And that number is continuing to go up. We peaked at over 600 cases a day back last year, so we're not at that point in terms of cases per day. There are some folks that are smarter than I am that do modeling, including Dr. Suzanne Judd at the UAB School of Public Health, looking out to the future, what we might expect based on experience in places like India, the United Kingdom, and also looking at what's happening down in South Alabama. And based on some of those projections, we do think things can still get a lot worse. One of the things that we're especially concerned about right now is our hospitals. And of course, the very tired healthcare workers that have been for us all through this pandemic who are, we're really worried about them and the stress that they're seeing now and going to see as this surge continues.
Well, I understand our hospitals have put off elective surgeries. Is that still in place? Is that a statewide thing?
Yes, they're starting to. It varies a little bit from hospital to hospital, but they are having to start looking at that. And one of their main challenges really is staffing, just not having enough staff to handle what we're expecting. But last year, we peaked at, I think, 683 hospitalizations here in Jefferson County back in January. We're not there yet. Right now, I think as of Friday, we were at 446. Yeah, so we're really concerned about our hospitals and, just looking at this past surge we had, the state peaked at about 4,400 cases, or hospitalizations, I should say, last January. Here in Jefferson County, we peaked at about 680. There's some projections statewide that show that we could potentially go as high as 7,000. That's 7,000 compared to 4,400. It hopefully will be a little bit lower than that, but that's sort of worst case scenario. And our hospitals, they could open up more spaces. They could even have field hospitals set up. But really the biggest challenge is just staff. There aren't enough people to take care of all these extra COVID cases. And also it's going to make it harder for them to take care of anything else that happens to show up in their emergency departments.
Well, is the staffing shortage a product in part of some of those that have maybe retired or don't want to come back to work under these circumstances? Or were we short to begin with? I don't have all the details
on that. I think that's some of it. There is also a competition across the entire country for staff, especially nurses, respiratory therapists. So it's just tough. And we're talking about numbers of hospitalizations that are unprecedented. These are not what our hospitals were set up to do. So really what we do right now is extremely critical. And one thing I want to do today is urge everyone in the public to do their part. It's back to those basics of social distancing, washing your hands, wearing masks, avoiding crowds of people where it can be spread around. And right now, one of the things that can make the biggest difference in the short term is to really wear those masks and wear them consistently. whenever you're around other people, unless all of you know you're vaccinated. But that's really the main thing we need to get people to do right now.
The spread that's currently out there, things I've looked at show people my age and above are in a high percentage vaccination rate. Fairly accurate statement? Is that a fairly accurate statement?
Yeah, right. Yeah, our older population has a pretty high vaccination rate, and that's really good. And because of that, we're going to be seeing less deaths this time around than we did early on. So that's really good news. But unfortunately, this Delta variant is so contagious, and unfortunately, because our vaccination rates are nowhere near they need to be for the middle-aged and younger population, those are the folks we're seeing get sick, and those are the folks that we are seeing actually end up in the hospital right now.
So when you say middle age, you're talking 50 and down?
Right, yeah. That's where we're seeing more and more people get sick and get hospitalized. And unfortunately, we're now seeing more children get hospitalized with COVID. And we're not talking about just children who happen to have COVID who are in the hospital for something else. We're talking about children who are sick from COVID, and that's very concerning as well.
And with school starting back up, of course, I mean, how do you manage a grade school kid with respect to keeping that mask in place? We're going to talk about that a little more when we come back. It's time for a break, so don't go away. We'll be right back. This is Our Issues Birmingham. Welcome back to Our Issues Birmingham. We're speaking with Dr. Mark Wilson, a Jefferson County Health Officer, about a very troubling set of circumstances that we're all facing. And I do not mean to be the prophet of doom. I am just a realist. And I would like to pick up where I left off with school children. So, and when I say school children, I'm primarily speaking of elementary school children, because I think I hope we can get our high school students to pay attention. And of course, you have the conflict between don't make me wear a mask and I'm not making you wear a mask. I'm telling you that it's in your best interest to wear a mask. So how do we deal with the elementary kids? And when they get sick, what's that look like?
Well, first of all, several of our school districts have decided to require face coverings for all children, staff, teachers, visitors. And that is in alignment with the recommendations that have come down from the state health department, and which I have strongly urged schools to follow. There are a few that have not chosen to do that and have made masks optional. And the problems with mask optional is, we understand people's individual rights and people's desire to make choices for themselves. But when you're talking about a highly contagious disease and putting a bunch of people in one room together for most of a day, it's not just your choice. It's what you're choosing for yourself could be putting somebody else at risk. So for masks to be effective in the schools, they need to be universal. Everybody needs to be wearing them. My mask protects me a little bit, but it especially protects you and vice versa. So we've actually had quite a bit of success last year with masking. And in fact, a lot of our young children have gotten quite good at it. When they're told what to do and they're told, this is what's expected of you and you're doing your part to help protect others, a lot of the children do it. Sometimes they need a little reminder. You need to get it back up over your nose, things like that. But we really had a successful year last year with the masking, in my opinion. We did not see a lot of outbreaks from within the schools. We were mainly having problems with things that happened outside of the schools.
Some people I have heard say words to this effect. My desire to not use a mask for whatever reason, whether it be political, whatever the reason, is now equated with selfishness. What would you say to those people that take that position?
Well, I don't want to point fingers or judge people, but I just would reiterate that that this isn't just about you; it's about all of us. And I really do hope that people will stop and think about that. And there's nothing really unique about this either. Somehow we've made this whole mask issue into a mountain when, in my view, it's really a molehill. We have multiple other instances of where you're required by law to do certain things in order to protect other people. You can't go into a classroom of children and smoke cigarettes all day, things like that. You can't drink and then get in a car and drive. You may say this is just about me and my decision, but there are multiple things like that that affect other people.
And as you say, it's not so much for the protection of me, it's for the protection of you.
Well, it's both actually, but I would say, it's definitely more for others than it is for you. You do get some protection if you wear a high quality mask, with multiple cloth layers. If you want to be really well protected, wear one of these disposable surgical type masks and then put a cloth mask over it. Make sure it's well sealed around your nose, around the edges, so that you're breathing through it and not around it. But we really, really need help right now. It's critical. And I would call it a call to action. We need everybody to step up and pitch in and help, show some love for our healthcare workers, especially. They need our help, and they need to be there for you.
When you say things are going to get worse based on the current trend, how much worse can it get? I mean, what does that mean specifically?
Well, one thing that really worries me are the conversations I've had with my counterpart in Mobile, which looks like it may be ahead of us by a couple of weeks in this surge. It seems to be spreading from the panhandle of Florida through South Alabama up this direction. They have a situation where the hospitals have no beds. The emergency departments are unable to accept patients that are being brought in by ambulances. There's just nowhere to put them. So ambulances are having to wait until emergency personnel are able to receive those patients, sometimes for hours. That's a really, really bad situation.
Yeah. Well, we'll talk more about what we can do besides the mask and what the future looks like when we come back from break. This is Our Issues Birmingham. Don't go away. We'll be right back with Dr. Mark Wilson. Welcome back to Our Issues Birmingham. We're talking about, obviously, the pandemic and things that are going on in our community and globally and nationally. So the vaccine. People are afraid to get the vaccine for a variety of reasons. Distrust of government. How will it harm me otherwise? How will it affect my fertility? Let's talk about the vaccine and how important it is just to take a second look at whether or not to get that and how it would affect what's going on in terms of these increasing numbers.
Well, we really are urging everyone who's not been vaccinated to get vaccinated. We really wish that had happened earlier, because right now the vaccinations aren't going to kick in soon enough to help with this current surge. But we're urging people to go ahead and do it. There have been a lot of questions, concerns, unfortunately, a huge amount of misinformation and distrust. But these vaccines, we now have a lot of experience with them and a huge amount of very careful oversight on the data that's coming in from people that have received the vaccines. So we know that they're extremely safe and they're highly effective. They're losing a little bit of their effectiveness with this Delta strain, but they're still very, very effective at preventing hospitalization and death. And that's really what you want from a vaccine.
Much like the flu vaccine. I mean,
Right.
people are going to get the flu, but they're not going to die from the flu. They do
and
die
this
from
vaccine
the
is
flu.
actually much more effective than the flu vaccine right now.
Are our numbers on the vaccination rate increasing?
Yeah, we've seen an uptick in demand lately because of the Delta surge. I think it's gotten people's attention, and maybe people who thought we were finished with this are realizing that we're not, and they had better roll up their sleeves. So here in Jefferson County, 49% of the population has gotten at least one dose, and 38% have completed their vaccination. So, and that's relatively high for Alabama, but we still have a very long way to go. With this Delta variant, we really need to be 85, 90% vaccinated to get this Delta variant under control.
Without taking us into the weeds scientifically, what makes this Delta variant different?
It has to do with the amount of virus that is in your nasal mucosa and what you're breathing out to other people. That's viral load or viral particles that are about 1,000 times heavier than the original strain of COVID-19. In terms of real life, it looks like it may be at least twice as infectious, probably much more than that, than the original strain. Whereas the original strain, one person might have infected maybe 2 other people. With this one, it may be 5 or 6 other people that the average person spreads it to. So that's the main thing. It's just highly contagious, and more than I think people appreciate. I think we're in a time right now when people have let down their guard. They're trying to get back to normal. But this thing needs to be taken extremely seriously. It's easy to get it. A lot of people that have dodged the bullet before are not going to dodge the bullet this time.
And so, for example, if I'm in a room, as I understand it, the transmission rate of the variant is in the 1 to 2 minute range. Is that an accurate statement?
There have been case studies where they've done careful contact tracing, where that has been the case, where the person who had it only was in contact with another person for 1 or 2 minutes before they transmitted it. We still have the same rules in terms of quarantining and all of that, but there have been cases of that, yes.
And with respect to the vaccine, you would assume that if our 1-dose rate is 49%, within a few weeks, our 2-dose rate, full vaccination rate, will catch up to that if people do what they're supposed to do. Correct?
Yeah, we would assume that. We are concerned that some people have, with the 2-dose regimens, have gotten their first doses and have not come back for their second doses. And I'm glad you mentioned that, because if you're one of those people, we strongly appeal to you to go ahead and get that second dose. Even if you're off schedule, you really need that second dose, because 1 dose of the Pfizer or Moderna vaccine is only going to give you about 40% protection or so, maybe even lower. You've got to have that second dose to get decent protection.
Yeah. The vaccination, what I was going to say, the people that get the vaccination today, we're not going to see those numbers reflected for even 2 weeks beyond that, I would think. So
right. Well, with the Johnson & Johnson vaccine, which is single dose, you should have the full benefit of that in 2 weeks. But for the others, it's going to be 5 to 6 weeks because it's 2 weeks after your last dose. So go ahead and get it as soon as you can. But in the meantime, you got to be careful. Social distance, avoid the crowds, wear your mask consistently. And I would avoid being in crowds where other people are not wearing masks right now.
Good advice, simple advice. Thank you so much for being with us today. Please, people, do something to protect your fellow mankind. Either wear a mask, get a vaccination, or both. Avoid large crowds. Thank you, Dr. Wilson, for being with us today with this good, solid advice for everyone. Ladies and gentlemen, we'll see you next week.
There is a road laid out for me, leading down to
boxes everywhere. And this is gonna be Addie's room.
I am blind, but I need not see.
I think you're really gonna like it.
I know this road is there for me. There is a love waiting for me.
First night here, but Amy seems cool.
Waist down by the river. I am blind, but I need not see. I know this love is there for me.
Nice and slow.
If
I got
I'm
this.
free, take me down to the river
Nice.
and wash me.
Okay. What do you think?
Whether it's advice on managing your anxiety or tools to help you stay grounded, Coping-19 provides a range of resources and self-care tips to help you cope with this pandemic. We can help. Find the resources that work best for you at coping-19.org.
My advice to all the fathers out there, they grow up way too fast for you to waste even a single precious moment.